Good afternoon, Mr. Altor. My name is Julie Robertson, and today I will be presenting my persuasive speech for KCTCS online. Good afternoon. My name is Julie Robertson. Today I'm here not only to inform, but persuade you to make sure to have a colonoscopy when it is time. I'm going to begin on a personal note. My grandpa didn't have his first colonoscopy until the age of 72. In June of 2006, at the age of 74, my grandfather passed away of colon cancer. Unfortunately, his cancer was not detected early enough, and the treatments were unable to cure him. He fought a long 18-month battle of chemo, surgery, and test after test, but it was too late. If only he had had a colonoscopy sooner, he may still be here today. Colon cancer is the second leading cancer killer in Kentucky and the third most common cancer in the United States. It is a preventable disease that, if found early enough, has a 90% chance of a cure. The risk factors include age, family history, weight, diet, tobacco, and alcohol use. To help reduce your chances of developing the disease, maintain your ideal weight with regular exercise. Limit the fat intake and eat at least 5 servings of fruit and vegetables a day. Limit alcohol consumption and quit tobacco use. The most important is to begin colonoscopy screening at age 45 for African Americans and 50 for Caucasians, and know your family history. There are signs and symptoms that could indicate a problem. Some of those are rectal bleeding, change in bowel habits, blood in stool, weight loss, or ongoing lower abdomen pain. The problem with colon cancer, it is referred to as a silent killer because there is often no symptoms. It is important for everyone to know the risk factors and ways to reduce your chances of developing colon cancer. Family history plays a large role because it determines when you should begin having your screenings. Dr. Jeff Tuvlin, a gastroenterologist for Jewish Hospital, recommends that at age 40 or 10 years before a first-degree relative was diagnosed, which would consist of a mother, father, brother, or sister. For example, if your father was diagnosed at the age of 46, Dr. Tuvlin recommends that at age 36 you have your first screening. If there are no abnormalities or other symptoms don't occur, you can have one every 5 years. For second-degree relatives, which consist of grandparents, aunts, or uncles, Dr. Tuvlin recommends that you have your first colonoscopy at age 40, and if that procedure is normal, you may go back to the general recommendation of age 45 for African Americans and age 50 for Caucasians, with a screening every 10 years. Colon cancer develops when cells in the colon or rectum grow and multiply. Most colorectal cancers develop from polyps. The cells and polyps interfere with the normal function of the colon or rectum and damage surrounding tissue. There are many tests that can be performed to detect colon cancer, but the most accurate is the colonoscopy. I'm going to give you a brief description of what to expect when having a colonoscopy. 1 to 3 days before you go in for your procedure, you will be placed on a liquid diet, which consists of broth, water, popsicles, and Jell-O. The day before your procedure, you will be prescribed a bowel prep, which will help cleanse and prepare your colon for the procedure. The procedure is done as an outpatient test and takes approximately 30 minutes to complete, depending on findings. During the procedure, the doctor uses a colonoscope, which is a long, flexible viewing tube which is inserted into the rectum and passes through the colon. The doctor examines the walls and the tissue of the colon, checking for any abnormalities or polyps. If polyps are found, the doctor removes them and sends them to a pathologist to be checked for cancer. Most polyps are found to be benign, but many are precancerous. Removal of a precancerous polyp helps prevent future development of cancer from the polyp. I'm going to pass around some pictures taken from a colonoscope. The first three are of a normal colon. The second picture is of a polyp that should be removed. And the third is pictures of colon cancer. Then, after viewing these pictures, I must urge you not to wait until it is too late. Regular screenings are important. The Colon Cancer Prevention Project is an organization that is working hard to educate and spread the word about colon cancer. I'm also going to give each of you a pamphlet with helpful information, statistics, and their website. Remember, when it is time, don't wait, get screened. Thank you.